peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. Now let's talk about the three main types of ingredients in moisturizers and how understanding these will help you choose the right product. First, we have humectants. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for adding hydration, for making your skin feel plump and supple. If your skin feels tight or rough, humectants can help tremendously. Second, we have emollients. Emollients fill in the spaces between skin cells, smoothing the surface of your skin and making it soft to the touch. They help repair your skin's barrier and make your skin feel comfortable. Ingredients like ceramides, squalane, and various plant oils are emollients. If your skin feels rough or flaky, emollients will help create that smooth, soft feeling you're looking for. Third, we have occlusives. Occlusives create a physical barrier on top of your skin that prevents water from evaporating. They're like that lid we mentioned earlier, sealing in all the hydration. Ingredients like petrolatum, mineral oil, and dimethicone are occlusives. They're especially helpful if your skin is very dry or if you live in a harsh climate. The best moisturizers contain a combination of all three types of ingredients. They hydrate with humectants, smooth with emollients, and seal with occlusives. This comprehensive approach addresses all aspects of moisture maintenance. Now, how do you choose the right moisturizer for your specific skin type? Let's go through each type slowly and thoughtfully. If you have dry skin, you need a richer moisturizer with more emollients and occlusives. Look for creams rather than lotions. Creams have a higher oil content and provide more intensive moisture. Your dry skin is telling you it needs more help maintaining its barrier and holding on to water. Ingredients like shea butter, ceramides, and hyaluronic acid will be your friends. Don't be afraid of products that feel rich and substantial. Your skin needs that extra nourishment. If you have oily skin, you might think you don't need moisturizer, but you absolutely do. Oily skin can still be dehydrated. In fact, sometimes your skin produces more oil because it's trying to compensate for dehydration. Choose a lightweight, gel-based, or water-based moisturizer. These formulas provide hydration without adding excess oil. Look for non-comedogenic products that won't clog your pores. Ingredients like hyaluronic acid and niacinamide work beautifully for oily skin. If you have combination skin, oily in some areas and dry in others, you have two options. You can use one balanced moisturizer all over your face, choosing a medium weight lotion that's not too heavy and not too light. Or you can use two different moisturizers, applying a lighter one to your oily zones and a richer one to your dry areas. Listen to what your skin needs and be willing to adjust seasonally. If you have sensitive skin, simplicity is key. Choose a moisturizer with minimal ingredients and no fragrance. Fragrance is one of the most common causes of irritation and allergic reactions. Look for products labeled as hypoallergenic and designed for sensitive skin. Ingredients like colloidal oatmeal, allantoin, and Centella asiatica can be particularly soothing. When trying a new moisturizer, always patch test it first on a small area of skin to make sure it doesn't cause irritation. Let's talk about texture for a moment because the way a moisturizer feels matters tremendously. You need to enjoy using your moisturizer, or you won't use it consistently. Some people love thick, rich creams that feel nourishing and substantial. Others prefer lightweight gels that absorb quickly and leave no residue. Neither is better. It's about what works for you and what you'll actually use every day. When you're testing a moisturizer, pay attention to how it feels immediately after application and then how your skin feels an hour later. Does it sink in nicely or does it sit on the surface? Does your skin feel comfortable and balanced, or does it feel tight, greasy, or irritated? Your skin will tell you if a product is right. Trust those signals. Consider the time of day as well. Many people benefit from using different moisturizers in the morning versus at night. Morning moisturizers are often lighter because you'll be applying makeup or sunscreen over them. Night moisturizers can be richer and more intensive because your skin does most of its repair work while you sleep, and you don't need to worry about makeup application. Speaking of sunscreen, if your moisturizer contains SPF, that's wonderful for morning use. But remember that you need to apply enough to get the stated protection, about a quarter teaspoon for your face. Many people don't apply enough moisturizer to achieve adequate sun protection. So you might consider using a separate sunscreen to ensure you're fully protected. Let's address price for a moment. Expensive doesn't always mean better. Some of the most effective moisturizers are quite affordable. What matters is the ingredient list and how the product works for your specific skin. Don't feel pressured to spend a fortune. A drugstore moisturizer with good ingredients can work just as well as a luxury product. However, if a higher-end product brings you joy, if applying it feels like a special ritual that you look forward to, and if it works well for your skin, then it's worth the investment. Skincare should feel good. It should be something you enjoy, not endure. When reading ingredient lists, remember that ingredients are listed in descending order by concentration. The first 5 to 7 ingredients make up the bulk of the formula. This is where you want to see your key moisturizing ingredients, your humectants, emollients, and occlusives. Be cautious of products that list water as the first ingredient, followed by many fillers before you get to any beneficial ingredients. While water is a necessary base for most moisturizers, you want to see nourishing ingredients high up on that list. One more consideration: seasonal changes. Your skin's needs vary with the weather and climate. You might need a lighter moisturizer in humid summer months and a richer one in dry winter weather. This doesn't mean you need to buy multiple products. Welcome to this peaceful space of learning and care. Take a deep breath in, feeling calm, enter your body. Exhale gently, releasing any tension. Today we're going to talk about preventing clogged pores. How to keep your pores clear and healthy through gentle, consistent practices rather than aggressive intervention. Clogged pores are at the root of many skin concerns: blackheads, whiteheads, acne, and rough texture. When pores become blocked with oil, dead skin cells, and debris, problems develop. But here's empowering news. Pore clogging is largely preventable through thoughtful daily habits and a gentle skincare routine. Let's begin by understanding what causes pores to clog. Your pores contain hair follicles and sebaceous glands that produce oil called sebum. This oil is natural and necessary. It protects and moisturizes your skin. Problems arise when too much oil is produced, when dead skin cells accumulate faster than they shed, or when external debris mixes with these and blocks the pore opening. Several factors contribute to clogged pores: excess oil production influenced by hormones, genetics, and stress; dead skin cell buildup from inadequate exfoliation or too rapid cell turnover; heavy or pore-clogging skincare and makeup products; inadequate cleansing that leaves residue on your skin; environmental pollutants that settle on your skin; and touching your face frequently, which transfers oil and bacteria. Understanding these causes helps you prevent them systematically. The foundation of pore clogging prevention is proper cleansing. Cleanse your face thoroughly once daily in the evening to remove oil, dead skin cells, makeup, sunscreen, and environmental debris that have accumulated. Use a gentle but effective cleanser appropriate for your skin type. For oily or combination skin prone to clogged pores, a gel cleanser with salicylic acid can be beneficial. Salicylic acid is oil-soluble and penetrates into pores, helping keep them clear. Use 0.5 to 2% concentration. Double cleansing in the evening helps ensure complete removal of all pore-clogging substances. Start with an oil-based cleanser or micellar water to dissolve makeup, sunscreen, and excess sebum. Follow with your regular water-based cleanser to remove any remaining residue. Cleanse thoroughly but gently. Massage your cleanser onto your skin for a full minute, giving it time to work. Pay attention to areas prone to clogging: nose, chin, forehead. Rinse completely with lukewarm water. However, don't over-cleanse. Cleansing more than once daily or using harsh cleansers can strip your skin, triggering more oil production and actually worsening pore clogging. Balance is key. Regular exfoliation prevents dead skin cell buildup that contributes to clogged pores. Chemical exfoliation with AHAs or BHAs is generally more effective and gentler than physical scrubs. Salicylic acid, BHA, is particularly effective for preventing clogged pores because it penetrates into pores and dissolves oil and debris. Use a salicylic acid treatment 2 to 4 times per week, depending on your skin's tolerance. This could be a toner, serum, or leave-on treatment with 0.5 to 2% salicylic acid. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell accumulation. These work well for many skin types. Use 5 to 8% concentration 2 to 3 times weekly. Don't use multiple exfoliants at once or exfoliate daily unless your skin clearly tolerates it without irritation. Overexfoliation damages your barrier and can worsen your skin. Choose your skincare and makeup products carefully to avoid introducing pore-clogging ingredients. Look for products labeled non-comedogenic, which means they're formulated not to clog pores. Common pore-clogging ingredients to be cautious of include coconut oil, though some people tolerate it fine, certain silicones in high concentrations, heavy oils and butters, some waxes, and thick, occlusive formulas if you're very oily. However, ingredient sensitivity is individual. A product that clogs one person's pores might be fine for another. Pay attention to your own skin's response rather than universally avoiding ingredients. For pore-prone skin, choose lightweight formulas, gel or gel cream moisturizers rather than heavy creams, fluid or gel sunscreens rather than thick creams, and mineral makeup or lightweight liquid formulas rather than heavy, oil-based makeup. Remove makeup thoroughly every evening. Sleeping in makeup is one of the surest ways to clog your pores. No matter how tired you are, at minimum, remove your makeup with micellar water before sleep. Moisturize consistently, even if you have oily skin. Dehydrated skin can actually trigger more oil production and more pore congestion. Use an appropriate lightweight, non-comedogenic moisturizer that provides hydration without heaviness. Sun protection is essential, but choose your sunscreen wisely for pore-prone skin. Mineral sunscreens with zinc oxide work well for many people prone to clogged pores. Lightweight chemical sunscreens are also available. Find one that doesn't feel heavy or greasy on your skin. Lifestyle habits significantly affect pore health. Don't touch your face unnecessarily throughout the day. Your hands carry oil, dirt, and bacteria that transfer to your skin and contribute to clogged pores. Every touch is an opportunity for contamination. Keep everything that touches your face clean. Change your pillowcase at least twice weekly. Nightly if you're very prone to clogged pores. Use a clean towel to dry your face, or dedicate a small face towel that you wash frequently. Clean your phone screen regularly as it touches your face and harbors bacteria and oil. If you wear makeup, clean your brushes and sponges regularly, weekly at minimum. Dirty application tools harbor bacteria and reintroduce oil and old makeup to your skin, clogging pores. Avoid heavy, pore-clogging hair products near your hairline and face. Pomades, heavy styling creams, and thick conditioners can migrate onto your face, especially along your hairline and forehead, causing clogged pores and breakouts. Use lighter products or keep hair products away from your face area. Manage oil production through lifestyle factors. Stress increases cortisol, which triggers more sebum production. Whatever helps you manage stress, exercise, meditation, adequate sleep, relaxation practices, indirectly helps prevent clogged pores. Stay hydrated by drinking water consistently. When your body is well hydrated, your skin is better able to regulate its own oil and moisture balance. Eat a balanced diet. Some people find that dairy or high glycemic foods increase their oil production and pore clogging. If you suspect a dietary connection, try eliminating these foods for a month and observe whether your skin improves. Consider professional treatments if you're prone to persistent clogged pores, despite good home care. Regular facials with professional extraction by a trained esthetician can help keep pores clear. Professional chemical peels provide deeper exfoliation. Discuss these options with a licensed professional. Retinoids, either over-the-counter or prescription, are highly effective at preventing clogged pores by increasing cell turnover and preventing debris accumulation. If home remedies aren't sufficient, consult a dermatologist about whether retinoids might help. Maintain consistency with your prevention routine. Pores don't clog overnight, and keeping them clear requires daily attention to cleansing and regular exfoliation. The habits you build and maintain matter more than any single product or treatment. Be patient with results. Even with perfect prevention, occasional clogged pores may occur due to hormones, stress, or other factors beyond your control. Don't judge yourself or your routine based on occasional breakouts. Assess your skin over weeks and months, not days. Remember that some degree of visible pores is normal and natural. Pores are real structures in your skin that serve important functions. You're not aiming for invisible pores. That's not realistic or necessary. You're aiming for clear, unclogged pores that function properly. As we close, embrace this truth.
Antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly